This could be Ontario's clearest sign yet. Lifting all COVID restrictions within months might be harder than first thought.
It's nothing short of alarming, not just the number of cases that we're experiencing, but the rate of rise. Very concerned about our public health system capacity.
Sudbury is suffering a sudden spike in cases and reimposing masking rules and capacity limits, while across Ontario,
we look still okay. We're in a good place, but we're on the wrong trajectory.
Thank you, guys.
He's pointing to simple measures that seem to be slipping, like having fans wear masks at indoor sports and ensuring restaurant staff are checking proof of vaccination. If things get worse, the health minister warns Ontario could still slow its grand reopening in the new year.
It is potentially possible, but we do know that there are going to be increases in cases as the weather turns colder, and that has been brought into the equation.
Across Canada, there are pockets of concern. Reminders strong nationwide vaccine uptake isn't enough to snuff out the Delta variant.
It is especially important for us all to remain vigilant now.
Quebec is again seeing case counts creep upward, and in Manitoba, the rise is even more steep. Yukon is declaring a state of emergency, fearing the healthcare system could quickly become overwhelmed.
We have 90% of eligible people first dose coverage. It's not enough.
Many Canadians might be making bigger holiday plans this year, but public health officials stress some caution may still be required.
As people are indoors and interacting indoors, those places that don't have that high vaccine rates are going to see the virus one way or another.
There's plenty to look forward to now. Overall, Canada is still faring well. The fear is, as hope is rising, vigilance is falling, and there's still a need for both.
Okay, so Thomas, given that, what are the public health experts watching for next?
They're going to be watching for any sign of exponential growth, Adrienne. That's when case counts quickly double and then double again, and that's when alarm bells start going off. We were speaking today with the scientific director of the advisory table here in Ontario, and he said within about 2.5 weeks, this province could be seeing 1,000 cases a day. That would be the first time that happened since last spring. Public health experts are just using this moment to tell people, remember personal vigilance, because no one wants to see explosive growth in case counts as the temperatures go down.
Yeah, no kidding. Thank you, Thomas. Thomas Degla in Toronto tonight.